Are we live? Hey, hello friends.
Hi.
Hi, welcome Fharzana.
Thank you for having me over here at Pearls Dentistry.
Pleasure having you, Fharzana. Before a small introduction, Dr. Arun, dental surgeon with more than 18 years of experience. We run our dental centers in the name of Pearls Dentistry. It's such a pleasure to have Fharzana Siraj, founder director of Orange Ray, with us.
Thanks.
A good friend of mine, and we've known each other for almost like 5-6 years now.
Absolutely.
Probably more than 5-6 years.
Yes, professionally and personally.
Professionally and personally, yeah. The reason we are here doing this live is, in my dental practice, as I see patients, one is we've got a lot of patients, who come, and generally dental patients are elderly patients and who already have some issues or the other with the neck or the back. Some problem keeps happening, right? So they not only come, they do come with a lot of dental problem because they're elderly patients, but they have some pre-existing problems with their neck or back. So sometimes they find it uncomfortable to sit on the dental chair, they find some back issues happening, they find some neck difficulties happening. So I thought that it would be great that if we call you here, and before I go further, what I would like to know is, like all of you know, she runs an alternative medicine center by name Orange Ray, and she's an expert in her field. I would, in a few minutes, ask her to introduce herself about what Orange Ray does and what all they do in our practice. But a small testimonial: if I had a back pain, and I had a big back pain, I went to Fharzana, I went to Orange Ray and got my back pain treated. So she is very good in what she does. So I thought that it would be best that if we can call her to a clinic and then ask her to explain about what can be done.
Thanks, Arun. Thanks for this opportunity. But before I talk about myself, let me compliment you on this wonderful, beautiful clinic. And I heard that you have some new digital thing happening here, a digital dentistry, what you call, and I would actually want you to talk about it later, right?
Sure, absolutely.
Yeah. So, hi viewers. And I am Fharzana Siraj, founder of Orange Ray. Orange Ray is a multi-speciality alternative medicine clinic. Just to make it easier for the viewers to understand, it's a little bit of jargon. We have all forms of alternative sciences under one roof, be it Ayurveda, homeopathy, yoga chikitsa, nutrition, and acupuncture. So I believe that every science has a lacuna, somewhere a shortage. And we are not able to cater to every patient's problem. But if we combine two sciences, we are able to address or fill that lacuna, and the patient is the winner. And with this thought process, I started Orange Ray, and I'm very, very happy that today we are able to address a lot of issues, because today all the issues are more lifestyle based. And we don't only use alternative medicine as a preventive measure, but as a curative measure. We've already seen the testimonial, and yes, so that's what we all do. And regarding what Arun was talking, Dr. Arun was talking, was about, let me tell you that among the healthcare professionals, surgeons and dentists face the maximum number of back pain and neck pain issues, only because they are always sitting in a very compromised position, not that compromised, but what I meant was they're sitting in such a way that they're trying to accommodate the patient and make the patient feel more comfortable. But in comparison, an average...
Let me
sure.
What I would like you to know is that I think there's a lot of, once we said that we go on live, actually a lot of dentists have asked that, is this a program exclusively for dentists or patients? But I would like to, can I have a commitment saying that can you do something exclusive for the dentist?
Definitely, I would actually want, because both of them are going to be suffering in a different way, and without any bias towards the dentist suffers more, because for the simple reason he's more on the chair than the patient. The average patient is about an hour max, but a poor dentist is here for 8 hours, 10 hours, 12 hours, depending on the practice. So we need to look after the health of the dentist as well as the patient. So more for the dentist in another episode, but today we'll talk about the patients. How's that? Yeah?
Perfect. That's perfect. That's perfect. So basically, so when they come, I was asking you about the usual, apart from the dental thing, the commonest thing that is there is when we make them sit on the chair.
Sure.
And so usually dentists previously when used to, you said the dentist had a lot of problems, right? So previously we used to, work from a standing position and then neck completely down.
Agreed.
Now, over a period of time with a lot of, health issues and back problems, we have learned over a period of time to sit and work.
Absolutely.
So when you sit and work, patients are also have to be in a, lying down position. And sometimes they are not so comfortable on the lying down position.
Yeah.
So first is how to make people comfortable on the dental chair.
Okay.
Make them. So let's start with something simple.
Yeah, so let's talk about, so let's imagine a patient's mental status the moment they enter. First of all, they are already in pain most of the time. Otherwise, nobody's just going to walk in, right? You have very few patients who are not in pain and just coming for a
come for a dental wellness.
Yeah, I do come. I'm just talking about generally, right?
Okay.
So they are already like a little bit under a strain, and we don't know from whether they brave the traffic and come or they come from a bad place. But they are actually kind of very wary and a little edgy, all right? And we all know that when you're wary and edgy, your muscles are tensed up, So with that already tensed up muscles and strain, you suddenly tell them you lie down and they know something he's going to do and he's going to just put me down. So they are kind of like very wary in the head. So the first thing, what you can do as a dentist is kind of sweep out them, calm them down, maybe offer a nice small drink or something to kind of make them feel that you're not their adversary but rather their ally. Okay, that's the first thing what you can do. So once the muscles start calming down, what happens? They are much more malleable. They can move it, right? So that's the first thing. The second thing is, sometimes some patients have already a pre-existing back pain. Now, for those kind of patients, now can we just look at this chair? Can I have a volunteer, please, if you don't mind? Yes. Yeah. So please lie down. So now, the perfect way to keep the legs, if you are having low back pain, is this little knees raised position, okay? Now, as you can see, the seat is already like this. But if the patient is experiencing more pain, we can take a towel, because this is a little small towel. I would require a little bigger one and roll it up like this, okay? Yeah, so we are going to use this one also as well, so that it becomes a little thicker, and we are going to just raise it up, yes, and we give him a little support. Yeah, spread your knees a little bit. Yeah, relax. Now I'm going to ask you, is this position better for your back than what it was? Yes. Yeah, sure. So he says sure. So this is one thing which we can do for the patients. If this pain is worse than this, we can just keep increasing this height.
So this also helps to relieve the back pain?
Back pain. So there's not so much of stress on the back muscles. The stress is being shared. Okay? So this is one thing what you can do. Alright. Now second thing, what I would advise is, now I know there are many times we need to keep the patient down lower and lower and lower, and sometimes need to go almost horizontal.
Right.
Only, yeah.
So I would like to tell you, because when I'm sitting here, so to work at this level becomes very uncomfortable unless I stand and then bend.
No, and that will be bad for you. I wouldn't recommend that.
I understand. So usually we end up moving the chair down, which is like taking the chair. I'll just try to move it down.
Yeah. Okay, so he's going down. Yes.
The chair keeps going down now.
So now wait, just hold on. So when you are going down, so the moment a patient is made to sit, and as I said, with the pre-existing mental, thought processes they come in, it feels like as if they're being thrown into a bottomless pit, So what you could do is, that is the time you just need to keep it. Now can you just take him up again? And we'll ask him again. So he's going to be our guinea pig. I'm sorry, I'm using that word for want of a better word. Yes, stay, stop. Okay, now as a patient dentist, we need to do this.
Okay.
And just go down one step at a time. Slowly, not yes. Is this better or the first one was better? Second one was better. Why? So it's a very simple thing. The moment you have a contact, he is not feeling as if he's being hurled somewhere, right? So he knows that this is a support here. So just this one left hand reassuring not only establishes a patient-doctor connect, but also makes him feel very reassured that you are there holding his back literally. So that is one thing.
Yeah.
And secondly, do not just go down deep, take it in stages, so he starts acclimatizing. So he's used to a particular level, and then when you sweet talk him, he's forgotten actually that, oh, he's being down. And then after some time, a little more. So you got to cheat the patient a little bit, you know? Yeah, without him being told that he's being going down, right?
I like to come with this to make the patients comfortable.
Yeah, this is for exactly, we're not cheating anybody for a bad cause, it's all for a good cause. But as doctors, we got to have to play with the mind of the patient to make them feel better. That's
sometimes what I would like to ask you here, Fharzana, is like, sometimes patients do have a cervical spondylosis.
Yes.
And they do have a stiff neck, and they do come with a lot of stiff neck.
Okay.
So one is in terms of reassuring the patient to make them sit over a period of time, slowly calm them. Having our forearm on the forehead helps to reassure. I understand that. But if there's a cervical spondylitis, is there something else that we need to take care?
Definitely. So let's assume now this gentleman, I think, is okay, doesn't have a neck issue, so he's able to balance it in. But most of the time, we normal people today, as seen, because we are all the time looking into our phones and tablets and whatever we are doing now, the neck is always in a state of flexion. Okay. Now 15 degrees of is scientifically been proven, lots of research being done, that 15 degrees of flexion for 3 to 4 hours is tolerated by the body. But more than that can get problematic. Now in this case, this actually when he lies down like this, the patient will feel nice. Okay. The reason being that it is not in a state of flexion, right? But if
he's extending his
he's extending and he'll actually feel nice because all the time he's anyway like that. So he's actually going to feel reassured unless he's really scared and he's holding his neck tight. That is why I'm going on repeating, he has to be calm, because when we are not calm, we are holding our shoulders and the neck muscles very tight, and that itself is a major cause of pain. Because when I see patients with spondylosis in my clinic, I need to, besides doing the physical things and besides realigning, I have to calm them down. Because people, they hold their shoulders. They don't realize, but they hold. So when they hold it like this, the trapezius muscles shorten, and that creates back pain. So even as a dentist, when you're actually very concentrating and doing some work, you do this. So when you do that, you will end up with pain. So the same thing happens on both sides of the chair, right? So now again for this, one more time, we will use the same towel, napkin, whatever, make a nice roll like a cylinder, and maybe double this one, because as I said, this is too small, and slowly we'll insert here into the curvature of his neck, okay? So this way, we are supporting the lordosis of his neck, that is the curvature of this neck, the natural curvature, and we are maintaining the S of the spine and not allowing it becoming a C. Now, is this better or the first one was better? This is better. Okay, fine. So why this is better? Because he's getting gently supported by this. But having said this, please do not freeze your neck. Once in a while, of course, while he's not working in your mouth, when he's just got up to do something, keep moving your neck. Don't freeze it. Don't freeze it. Okay? So if you keep moving like this, your neck will not freeze. Yeah. So this is for somebody who's already having spondylosis.
Okay. Yeah. So there is there any way that the spondylosis can get worsened because they are in this position? No. But you said that since it's chin up position, it's actually going to relax.
Yes. Only thing that muscles might be tired. The spondylosis will not get worsened, but they might feel fatigued because it is tiring. The muscles are weak, so that's why we are propping them up.
Yeah. Another thing, what happens is usually when the patients sometimes when they rise up to sit on the chair to take some water or something, they'll spit it out.
Yes.
So people will say like if he's going to get up, so he's Dr. Arunkumar, so he's the patient for the day.
Okay.
So if he's going to sit up, so he will have a good strong abdominal muscle. He doesn't want any support. He can get up like that. Yeah. But sometimes what happens is with the back pain, with the abdominal muscles not strong enough to protect.
Slack muscles.
What we do is we raise the chair up to go up and then they sit up.
Correct.
So that's what they usually do.
Absolutely.
Is that enough or anything else?
What you could do, even if you're not raising them up completely, you can, let's say, can you just put it down again?
Sure.
So you have to give an unbiased opinion again. Okay, this time fold your leg. The right leg, fold your right leg. Fold it. No, fold it. Yeah, bend it. Yes. Now slowly turn. Don't lock your hands. Yeah. Turn here. Turn on that side. Slowly. Just turn. Yes. Now use the support of your elbow and the support of this palm and sit up. Yeah, sit up. Yes. Was this easier than just sitting up like this? Yes? Sure. Why? Because when we folded the legs and we took the help of the elbow, the weight is evenly distributed. Please do not ask all your patients never to get up like this if they are already a back patient, because 300% more pressure is exerted on the spine if you get up like this.
But went on real quick. Can you do a little bit, one more demo of turning around? So, it becomes, so people who are watching it can see that.
Okay, so yeah, fold your right leg, bend it. Yes, bend the other one. Yes. Now turn slowly the other side towards the base pin. Yeah, turn nicely, nicely. More turning, more turn more. Yes. Now use this support of this elbow. If you can you show here, please focus here. Support this elbow. Use this hand here. Now get up. Yes. Yes. Light, absolutely. Yes. So this is what back patients need to do. Okay. Do not allow them to just sit up like this.
So generally, what we do on the dental chair is we raise it up.
Yeah.
So it becomes so this back gets supported. True, but sometimes we don't raise all the way up. Even now, he's going to turn around. He's turn around, bend your leg and turn around.
Yes.
And it becomes easier for you to split because it gets supported.
The whole body is moving.
The back gets supported because it's turned around.
Absolutely.
Not much of force on the abdomens.
Absolutely. Yes. Yes.
So,
any other difficulties you face?
One other. So this is good because we spoke about the neck, we spoke about supporting the back, we spoke about reassuring the patient.
Yes,
so let's rewind whatever we spoke about. The first thing is of course to reassure the patient. The second thing is if it's a neck issue, how do we take care of the neck? If there is a back problem, how do we take care? How do we turn the patient and then let them
One more thing, sorry, I just remembered something. In case the patient has a wrist injury, then the way I told him to get up is not advisable because I don't want the pressure on the wrist. Yeah. So in that case, what happens? Whichever hand is painful, avoid that hand and use the other hand.
Okay.
So that's something you'll have to remember.
So basically, support the other hand and then
absolutely.
And then get up. Alright. So one is this. Of course, we spoke about this. So I know that we're going to do something special for the dentist.
Yes, because that's a lot of things to do for the dentist.
Now that we are here, so one tip which you think that you can actually help the dentist. So if there will be a lot of surgeons and dentists also looking at this.
Yeah, because it's like I was going through some research and I saw it was alarming because I also have some of the biggest names in the dental world in Chennai as my patients, and including you. Okay, so I know for sure that this is what would I say, professional hazard you guys are facing, and I actually feel sorry.
But one, because I know that, but what actually has helped me is practicing yoga and constant exercises does the world of good.
True.
So that, but preventing is
so preventing is always better than cure, always. So one thing I would tell you that when you are sitting down, I mean, like if you can just move and please show the chair. So I believe there is another kind of chair also available called a saddle. I personally recommend that for the simple reason that when you are sitting with a chair which does not have a backrest, you tend to sit upright. You maintain the S of the spinal curve. Okay, but the moment you have a low back, okay, I'll just show this to my viewers. See, I'm sitting without a support. This is how I'm sitting. Now, if I would sit with a support, just see the curve of my back, how it is becoming convex. So that is not good for the dentist at all. So the first thing is, if it is possible, change the chair. If it's not possible, at least when you are doing this, see to it that you are pushing your shoulders back. So Arun, you can come back a little bit inside more. Yes, push your shoulders back and keep your elbows to yourself. Do not position yourself in such a way that the patient's head is almost in your lap when you're working, so that you don't have to keep extending. So this abduction in the arm causes a lot of problem. So it's basically taking it away. So every time you do that, it is very painful. So you just keep your elbow stationed here and you work. So the natural hang of the hand from the shoulder will really help you.
I've got a confession to make.
Yeah.
I think it's easier to get treatment than to work like this. So it's going to be really difficult to work like this. But I don't know.
No, I'm not saying like you just become like this, but just think about it. Of course you can use, but it's like every time it's a simple things like even if you're cooking. I mean, this tip could be for a housewife. If you're cooking, we need to get all our ingredients together. Imagine if you're going here and you're going here and then all over the place you're going, it's going to be painful, right? So it's just keep everything very handy so that you don't have to keep moving. And another most, okay, we're going to do this one.
We're going to do this
You're actually tempting me to say everything now.
We'll do a separate video for
Sure.
the dentist.
Any questions are coming up?
No.
So one other thing which we need to see is we spoke about the back. And we spoke about reassuring the patient also. Another thing what I would like to know is sometimes patients are, I know that you're into yoga, pranayama, a whole lot of things.
Yeah.
So there is a lot of people who come with a lot of stress. Right? So one is connecting with the patients, reassuring them, making them comfortable is one. What do you think that the patients themselves can do?
Nice.
Before they visit the dentist.
Okay.
So it's not before they visit the dental clinic. That is from their end to relieve the anxiety.
Yeah.
Of course, checking about the dentist and about the treatment, all those things are separate.
Yeah, checking the credentials of the dentist is
That's all secondary.
absolutely.
But because some people are genuinely scared.
I agree. So let me explain. Fear is the most debilitating factor for anything, okay? And that is something, and the only way to remove fear is to fix it. There's no other way, alright? So now what we can do now, a patient has to understand that he or she, if he requires a dental treatment, they require it, period. There's no way running away from it. So make the most of it. So from their point, the moment they're sitting in the car or in the bus or in the auto, whatever mode of transport, it will take normally 15 to 30 minutes to reach your dentist. Use that time to switch off your phone, calm yourself, gather your wits, and you could do some slow abdominal breathing. I'm going to give you a very short demo here. Why the breathing? Because breathing is the bridge between the mind and the body. So the moment you calm your nerves through breathing, you're fine. Physically you're fine, mentally you're fine, you're open to knowing more. Otherwise you're holding on with your fear and your muscles are very tight. So we'll just look quickly. So let me tell you, when you inhale and when you exhale, what's the difference between that? So when you inhale, your belly goes out. When you exhale, your belly goes in. I know a lot of people who are watching this will be saying, but I just do the opposite. Yes, I know. A lot of people, most of the people actually do the opposite, and that's where the problem lies. I'm repeating, inhale, belly out, exhale, belly in. So least thing what we can do is just sit in a very comfortable position. I'm not going to give you any fingers, nothing, no fancy stuff, just basic. Sit upright, manage to open up your spine, don't slouch, just open it up, okay? Keep one hand on your belly. Now we begin with an exhalation. So when we begin with an exhalation, pull your navel in and throw out your breath, but do it very slowly, almost miserly. So I'm starting, this is the action for exhalation, this is the action for inhalation because I won't be able to talk. Now you would have noticed that my exhalation is longer than my inhalation. That's what I want you to do. When the exhalation becomes longer than the inhalation, not only you're removing toxins and all of that stuff, but you're calming yourself down. So remember, inhalation is long, but exhalation is longer. If you can breathe like this, like a miser, for the next 10 minutes or 15 minutes, trust me, when you come here, you're going to feel light, no weight on your shoulders, and you'll be actually excited to take the treatment from Dr. Arun.
Hey, thank you so much. I think it's a very. I think before we proceed, can we dismiss our patient?
Yes, sure.
Thank you
so
so
much.
Thank you so much. Right. That's a very. I think the breathing technique is a very useful. I think that's how babies breathe, right?
Absolutely.
So babies
Actually, if you see small babies, yeah,
small
the
babies,
belly goes up and down.
belly goes up and down, and typical belly breathing is done by small babies, but unfortunately as we grow up, the stress and the whole catches up with us, and we lose, and we lose how the focus on how to breathe, and that ends up the problem. I think it's been a very great interaction, Fharzana.
Thank you so much.
Thank you so much for coming. And before we close, if there are any questions, can they email you?
Yes, they can email me. I'll just share my email address. So it's Fharzana, Fharzana .Siraj, SIRAJ @orangeray, ORANGERAY.in. Fharzana Siraj @orangeray.in.
We'll put it in the comment section also. If you have not followed it, we'll put it in the comment section.
And if you need to ask me anything, and we're there on Google, and we're there on Just Dial, and we're there all over, I think.
And they are very good too. So
thank you so much.
So thank you so much for coming. And before we said that, just a quick summary. So we will be doing a exclusive program for the dentist and the surgeon.
Yes.
So so we will soon announce the dates for the Facebook Live.
Yes, please.
And Fharzana was sharing that we're coming out with single visit dentistry. I will speak more about that.
Please.
Okay.
Later?
Okay, I'll do a brief few seconds.
He's giving a teaser. Okay.
Brief few seconds. The usual, method by which you make impressions is to mix a mold and make a mold out of it and then send it to the lab and then do. Now it's completely digitized. Technology has taken dental mold by storm, and we can just scan the teeth, and the impression of the teeth just by a scan comes onto the computer.
Super.
And we can design the crown and make the crown immediately, and I can get a crown out in 20 minutes.
So that means if I'm coming from abroad just for a short trip, or maybe going to Tirupati via Chennai, one day you can fix my teeth and
absolutely.
Oh, that's wonderful. That's amazing. That's really nice.
That's really so more about that soon. And thank you so much. It's been great interacting with you, Fharzana. Thank you.
Thanks. It's a pleasure.
See you soon on the next.
Bye.
Bye-bye.